basically I've described everything. So probably bilateral level 2, 3, and 4 nodes that were somewhat suspicious. Big mass in the thyroid gland, multiple suspicious pulmonary nodules. So with that discrepancy, again, I'll ask the panel here. So concerning looking PET CT scan, you've got a fine needle aspirate that's called the papillary thyroid cancer. Any thoughts on next steps?
What are you thinking, Erik?
You know, relatively young person. I mean, we used to say 45 years old was a cutoff in terms of AJCC staging. Now it's 55. Young person, papillary carcinoma on your biopsy. You know, when Zubair's second read, so to speak, raised the kind of issue of high-grade features, that catches my ear a lot. You know, nonetheless, I'm still thinking the traditional kind of standard, which is surgery, radioiodine as a consideration, a young person. So I'd take the thyroid out.
So I appreciate that. That was a consideration. From my perspective, when I see this aggressive type disease, I prefer to get a second opinion and possibly more tissue for biopsy purposes to see what we're dealing with. Because this clinical picture in this patient with a straightforward papillary thyroid cancer isn't typical. So we did that. And we did a core biopsy.